why the lateral hip strength is so important is because it's important for pelvic floor health, knee health, hip health, low back health, and as well as preventing osteoporosis in the neck of the femur, which is one of the main areas where fractures happen when we get older, is in the neck of the femur. And that's because we're not using our bodies the way they're designed to be used throughout our life. For instance, if you imagine this as a femur and you're stepping on it when it's aligned, you get a proper squish through the bone, so that helps build bone density. But if you're off to the side like this, every step you take torques on up here, the femur, and also the knee, and you're not getting that weight-bearing exercise through the whole bone. So what inspired me to do this video is I was watching a client come up the stairs, and every step she took was like this. Her hip would slide out to the side. And she was on her second knee or hip replacement and having a lot of problems still. So ideally, when you go upstairs, you want the pelvis to be stabilized, and you want the strength of the lateral hip to help stabilize the head of the femur in the hip joint. And so when you step up, you don't see that side-to-side motion. And so with this pelvic model, here's my femur again, which is an actual femur that I carved into a wooden spoon and painted to look like a wooden spoon. And so when my client was coming up the stairs, this was happening. And you see how that would add stress to the ligaments here that hold the femur in the hip joint. And so what you can do to strengthen those lateral hips is a pelvic list. And how you do a pelvic list is you stand with your feet pelvis width apart, with your feet forward, outside the edges of your feet lined up, and you stand on one foot, pressing that leg into the ground. Now there's not a lot to see here because I'm only lifting enough to clear the opposite foot from the ground. And you can stand and you can hold it for up to a minute. And this is great. You can hold on to the side of a wall if you want, or you can do it at the post office, or when you're in line at the grocery store, you can hold on to the person in front of you if you want. Just explain what you're doing. And you should feel a burn right around here, which is the glutes and the tensor fasciae latae, are the muscles that you're working to help stabilize the pelvis. And you don't want to have your leg come out like this, and you don't want to use this quadratus lumborum to hike the leg up either. And now this exercise is great because this is actually what you're doing with the first steps you take, at the beginning of every step you take, because you're pressing into the ground to clear this foot to step forward. So, alright, that's it. Happy hip health.